either activate or slow down. Okay. When they activate, you may feel like you always got to go to the bathroom. Like, I need to poop, right? And so some people have that kind of reaction where it's just like, my period is here and I just keep going to the bathroom and trying. Doesn't mean that it's coming, right? But you keep trying to poop. And some people actually may have the opposite, where they have a lot of constipation. Okay. And so with that, your gut health is everything. Okay. Your gut health is 100% everything. Make sure that you're taking regular probiotics. Make sure you're eating well. You want to cut down the sugars. You want to cut down all the processed foods. Yes, it's hard when your cycle is on. I know. I go through this too. Okay. I go through this every single month. But what happens is that the more that you are feeding your body with the things that the body feels like it needs, the things you crave for, some of that is causing your hormones to become more imbalanced and makes your cycle even more difficult and these struggles even more prominent. Okay. But again, we can keep talking about this, and stay tuned. If you've not signed up for my newsletter from my website, it's callmedrp.com, the same thing as my username, but .com. And without the period, callmedrp.com. Sign up, because once my website launches in a couple of weeks, there's so much information that I'm going to provide for you that you can read, see, and enjoy to help you. Okay. All right. So let's take a couple more here. I had a tubal ligation. Okay. That means a tubal, a BTL. Okay. I lost the question. It keeps changing. All right. Let's go to another one. I'll get back to it. Can someone still build muscle tone after completing a hysterectomy? Yes, let's talk about it. What is a hysterectomy? Let's talk about it. Let's bring out Ivy, okay? All right, so this is Ivy, all right? So Ivy is like the big plush uterus, okay? And it's easy for you to understand when I show you an Ivy, okay? So internally, there is a cervix. That's the red area here. The cervix is this entire portion that you see here. This overall is a part of the uterus. This is all the uterus. Okay, let me get a pen here. All right. Let me cap this here. All right. So this is your uterus. Your uterus is this entire area here. The uterus does two things. Pregnancy, carries your baby, delivers your baby, or periods. That's it. Your uterus does not cause or provide or produce hormones. That's not its job. Your uterus does two things, pregnancy or periods. So if you get your uterus out, a total hysterectomy means you're taking this entire structure out. A total hysterectomy has nothing to do with the ovaries, which are these purple areas. They're not purple in the body. They're really white. But on Ivy, your ovaries are purple. Purple ovaries are the areas where hormones are produced. So if you do have a hormonal issue, this is where it's coming from, the ovaries. If you take out the uterus, nothing changes because your ovaries there, even if you're having a total hysterectomy. A partial hysterectomy simply means that when we remove the uterus, we cut it here. So we cut here and take out this entire area, and we leave the cervix behind. So people who have partial hysterectomies will still get pap smears based on the pap smear schedule, because this portion where pap smears are done is still there. Okay. People who get a total hysterectomy do not have a cervix anymore. So if your pap smears have been perfectly normal as you've been going through life without any issues with HPV or bad cells, then you're a candidate to get the entire thing out without having any more pap smears going forward for the rest of your life. Okay. So hormones are not coming from the uterus. Now, if you do get a hysterectomy and along with the hysterectomy, you take out the ovaries, okay, that is called an oophorectomy. If you also get an oophorectomy, that means that if you are not menopausal, you no longer get hormones being produced from your ovaries as you usually would, okay? Does that make sense? I wish I could hear you, all right? But does that make sense? Yeah? Okay. You love Ivy? I love Ivy too. Ivy is a great plush. I super love her. All right, let's go into some more questions here. What is a normal or more common discharge? Good question. Because discharge can range in a lot of different colors, types, and textures. And guess what? All those discharges, your discharge will change throughout the month. All right. So you can literally have a certain type of discharge. Say you had your menstrual cycle August 1st and your cycle ended August 7th. By August 8th, you might have a different type of discharge. That discharge might have a little bit more of a brown tint with it and might last like a day or two. That's normal. Then by August 10th, your discharge may be white. Okay. And white and light, meaning that it's not very thick, it's not clumpy. Okay. White discharge in that sense is normal. Then you get to ovulation again, say August 15th. When you go through ovulation, your discharge changes to be more clear and more sticky, okay, and stretchy. Why? Because that type of discharge helps sperm along because your body says, hey, I'm ovulating. Not that I'm ovulating, I want sperm. Okay, so your discharge changes to allow sperm to slide along easier and to get inside from the vaginal space here all the way through to the tubes. Okay, so clear discharge does that. But guess what? Once that egg dies, okay, so you ovulate, it goes from the ovary, pops out here. The egg then hangs out inside the fallopian tube, waiting for your clear discharge to help the sperm along. When that doesn't happen, the egg dies. And the egg says, well, I tried, right? Once that change happens and the egg dies, then your discharge changes again. And that discharge could be a little bit of like a yellow discharge, a light one, or it could be white again. All right. And then you go into your menstrual cycle and it goes around and around the cycle over and over again. All of those that I mentioned are normal. White, thin and light, yellow, light, yellow, and clear, normal. If your discharge is now becoming very green, gray, frothy, bubbly, if it's different colors, yellow green, if it's becoming thick and clumpy. And we often, compare a yeast infection to cottage cheese like, okay? The discharge becomes like that, becomes very smelly, like fishy like. Those are abnormal discharges, and those are the ones that we want you to see your provider so they can test and see what's going on, okay? All right, good question. All right, let's see here. Is an IUD safe? Okay, I have a TikTok on this that I posted probably about, I'm going to say maybe about 5 or 6 TikToks ago. IUDs are safe, okay? And IUDs are safe where you have a provider who's inserting them safely. Okay, so whether it's a nurse practitioner, a nurse midwife, a physician, a surgeon who's inserting it, they are safe. IUDs, babe, do you mind grabbing my IUD? I'm going to show you what an IUD looks like, and we're going to look at this model. Okay, so inside of the uterus, right? So if we looked at IV again, this is the entire uterus on the outside. When you open up the uterus and take a look on the inside, this is what it looks like. There's a space here called the endometrial cavity. That cavity is where an IUD sits. Okay, so if you think about it, if this was completely closed over, you can't really see that space. So it's a blind spot. And I say that because your provider has to have the skill set that's necessary to place this into this blind area safely. Okay, so can things happen? Yes. Is there a risk to it? Yes. And I'll explain what those risks are in a second. So this is what an IUD looks like here. And it's in the instrument that is placed in. So no, this is not all inside you. I'm going to show you this portion only. It's a T-shaped, okay? This portion is what stays on the inside, okay? And it sits on that inside space here, like that. So once an IUD is in place and the strings are there, you should not feel it. It's not in the vagina, An IUD does not go in the vagina. It goes inside of the space inside of your uterus. Once it sits there and it's well in the space, it's not in the muscle, it is not in your abdomen, it is not in your heart, okay? It's in the space, and the space is closed off from the rest of your body, all right? It can't get lost, it can't go anywhere, all right? Now, a risk to IUDs is that sometimes in the process of placing them, they can go further than the space. And I'm going to show you what that may look like. All right, so let's get this figure up again. All right, so this is the IUD, and say we're placing the IUD, and instead of the IUD staying right there in that space like this, the IUD gets pushed into the muscle like that or beyond, and it pokes through the uterus. This situation that you're seeing right here is what is called a perforation, which is the most common problem or risk to get in an IUD. So the provider places it, but it passes the space and goes further along. And sometimes that could happen on the side. So it might come into this area. Let me do it so you can see it, or it can go on the other side. And the likelihood of that happening is very slim. It's less than 1%. So if it's misplaced, that's called a perforation. So with that, sometimes it might need to be pulled out and removed. Sometimes it might not go all the way up in the space and it might stay right here in the cervix. That's not normal either, okay? Outside of that, an IUD is fine, okay? Everything comes with a risk and a benefit, okay? And you need to balance those out to see if that's a good option for you, all right? So IUDs are great. And yes, they are safe, okay? All right, so let's get a couple of other questions because it's already been like 50 minutes. I can't believe it. All right, let's see whose question I'll grab now. What is premenopause, and am I going through it at 37? What are the signs? Can you go through premenopause early? Yes. All right, so let me talk to you about it a little here. Okay, so we didn't do like a full review of the anatomy, so I'm going to do that quickly so you can understand where we are. Okay, so we already identified the vagina. We have the cervix, which is the lower portion of the uterus. This is the entire uterus here. You have 2 fallopian tubes. That's number 1. Number 2 is on this other side here. Then you have 2 ovaries. Okay, so your ovaries are very important. They are producing all your hormones. They're producing, not all, but from your pelvic structures. They're producing your hormones here, and they're making your eggs, and you're ovulating those from month to month. Okay? As these are normally happening here, your body is in what would be completely normal state. Everything here is completely normal. Okay? Now, every female was born at birth with all the eggs that she will ever have for her lifetime. So when you ovulate from month to month, you are not you're not creating a new egg. You were born with that. So if you're 37, you've had eggs for 37 years. Okay. Now, as your eggs are maturing that you were born with, every month you ovulate and you release one. All right. But every day eggs are dying. So if you were born on average, say you were born with 4 million eggs, every day you're alive, a stack of them. We don't know how many in total, but you're losing hundreds and hundreds of them every day. So on average, you will have a period for 450 of those eggs, and the rest of them will die out over time. Once they die out and you have no eggs left, you are now in the process of getting to menopause. Why? Because your body says, I have no more eggs, I can't get pregnant, I'm not going through this process anymore, and shuts down. So it does not produce any of the hormones in your ovaries anymore, they shrink. The average age of menopause is 51. So average, that means that some people may go through menopause at 47, 48, 49, or some may go through at 53, 54, 55. That's the average. Now, some people may go through menopause prematurely. That means they go through menopause before they've gone to the age of 45, 46, 47, which is early. Some people it can happen at 35, some people at 40. And it can happen for different reasons. For instance, if you had chemotherapy or radiation or surgery, you can cause your body to go into menopause by removing these ovaries or preventing them from functioning normally. Okay? Now, if say you were just like, I didn't have any of those things. I've been fine, but I'm having symptoms. What are the symptoms of premenopause? Premenopause are the 5 to 7 or 8 years leading up to menopause. So say for instance, your mom went through menopause at 47. There's a good chance you may go through menopause in your 40s as well. 7 to 10 years before that, you can start to have symptoms. And those symptoms can be hot flashes. I've had one, all right? And I'm not menopausal or premenopausal. Okay, so a hot flash or a hot flush means that you go through a period where you get so hot. You're burning up hot, like there's a fire. And 3 to 4, maybe 5 minutes later, you get extremely cold. And now you're just like, it feels like it's the middle of the winter and it's like summertime and it's nowhere close to being, 20 degrees outside. All right, that's a hot flash. Happens within a 10-minute period, you're back to normal, okay? It's a change in the brain that causes your thermal regulation, meaning the areas and the centers in your brain that controls temperature, to become imbalanced, okay? And they're often affected by hormones. So when your hormones are being affected in your ovaries, it can cause your entire system to act differently and cause a hot flash. Okay. Another very common thing that people may feel as they're going through a premenopausal state is that they may have night sweats. Night sweats meaning that your bed would be completely soaked. Your bedding, your pillows, everything that you're wearing, if you wear night clothes, everything is soaked through, like you can squeeze water out of it because you're sweating so much. Those are called night sweats. And if it's not because of a disease or a sickness that you're having for some other reason, it could be because of your hormones causing imbalances and you could be premenopausal. Okay. Does it often happen in 37, the age of 37? No. Can it? Absolutely. All right. So hopefully that made some sense there. All right. So let's take a couple more. Let's see. I'm going to go back a little bit. I'm just randomly picking these. Okay. So let's go back. All right. If anyone has gone through menopause after a hysterectomy, it means that their ovaries were removed. So that is a surgical menopause. Okay. And oftentimes those people are given hormone replacement therapy because we've removed the hormones for them. They need to get a supplement of hormones so that your body, menopause can be tough on the body. Okay. Not everyone goes through menopause the same degree, but your body changes, the way you feel changes, the likelihood of you getting infections change, UTIs may increase, vaginal infections may increase, everything becomes a little bit less elastic. Your muscles change, a lot change. Your mood, your depression, anxiety, a lot of things change. So if you go through that too early, that can cause, or suddenly, that can cause a lot of disruptions. So getting those hormones, even at menopause, it may be helpful to get some hormone replacement therapy to help you with that. All right. Can I talk about adenomyosis? Yes, I love this stuff. I'm like a little nerd. I'm sorry. All right. So adenomyosis is, let me go back. Let's go back because I want you to follow along with me and understand what I'm explaining. Okay. All right. So normal cycles. When you have a period, remember I said earlier that your uterus, the purpose of your uterus is to do two things: periods, pregnancy. That's it. Okay. Now I'm going to go really close up here so you can take a look at my image here a little bit better. Okay. The uterus has 3 different layers. This middle layer, these are muscles. Okay. They squeeze, they contract, they cause cramping, they cause a baby to be born. This is the muscle of the uterus and that's what they're there for. Okay. The outside of the uterus here is like skin. Okay, so it's like the skin that we have in our body that covers up on the muscles and the bones we have inside. This inside space here is called an endometrial cavity. And the reason we have that cavity is a space, is an opening. It's like a cave inside. That area is where bleeding and periods come from. And so we have a lot of glands and cells that are specific for that area. So the same way we have, like, our palms are thicker and has more strength to it so we can do things and function. And the back of our hands are very thin skin and it's very different. This area in here produces a lot of bleeding and things that causes growth, okay? So these glands are supposed to remain in this space because that's where bleeding comes from. Bleeding happens here, comes through the cervix, goes through the vagina, comes out of the body. Whenever these cells that are supposed to only be in this inside space are found here in the muscle, that is adenomyosis. So think about this, okay? If these cells here, if their purpose is to cause bleeding, guess what they're doing in the muscle when they're found in the muscle? They're not supposed to be in the muscle. Yes, they're causing bleeding in the muscles. Adenomyosis can cause heavy bleeding and can cause a lot of pain when your cycles come. And it's very, very hard to diagnose. Why? Because these cells are so tiny that it's sometimes very hard on ultrasound or CAT scan or MRI to see that. Sometimes we can, okay? Unfortunately, most people don't know they've had this issue in their lifetime until after either they get a hysterectomy, because we take it out and we look under the microscope and examine the uterus closely and we find that the cells on the inside are also in the muscles as well, or they never find out, unfortunately. Okay, so that's what adenomyosis is. And it's kind of similar to what endometriosis is, because the same types of cells that are supposed to be here are also now found elsewhere in the body, internally. So if I were to show you my image here, this is without the uterus. I've taken out my uterus. Okay, that's my uterus on the inside. I took it out. It's without the bladder. I took out the bladder. It's without the colon. Okay, so it's an empty space. Those three items would be sitting in your pelvis right now. Okay, now endometriosis is when those same tissues on the inside of the uterus is now found all over inside. You find them all over the uterus on the outside. You find them on the bladder, on the inside of your abdomen, and it shouldn't be there. So when you're having bleeding on your cycle, the cycle is not just on the inside of the uterus. The cycle is also happening everywhere those cells are found. All right. So you can imagine if you're bleeding on the inside of your belly when you're having a period also, you're going to have pain and cramping on the inside of your belly. Okay, so that's why endometriosis is a difficult disease. Adenomyosis is a difficult disease as well. Okay, all right, I'm going to take one more, just one more, and then we're going to do this again next Sunday. Okay, and as I mentioned before, go ahead. Oh, you said PCOS. Oh, can we talk about PCOS next week? Because I would take one more question, but I really want us to really talk about PCOS, okay? And so I won't have enough time to dive in the way I want to. So we're going to hold that for our live next Sunday, all right? But I'm going to take another one today. But go ahead over to callmedrp.com and sign up to know when the launch happens, because again, you're going to have a ton of information on my website, and I'm so excited to present it to you. So go ahead, callmedrp.com. So call me doctor, spell it out just like my username. Okay, callmedrp.com. All right. All right. So let's take one more. Let's see. I'm just going to scroll through and wherever it stops. Let's see. Is it true that products from tampons can cause cancers? Yes. And it's not just tampons. It's tampons, it's pads, it's anything we put in the vagina. It is anything we use on our skin, the lotions, it's the soaps, it's moisturizers, it's the makeup we put on our face, it's the things we eat. All of these things can cause cancer. And so I'm not saying don't do anything and be smelly and don't use deodorant and don't shower. I'm not saying that. What I'm saying is that you want to become educated and you want to avoid things that you know for sure will cause cancer. And there's a ton. I've done a couple of TikToks on this. I might do another one coming up soon so that we can refresh your feed and your memory on things that can cause you to have or be exposed to cancer. Okay, so parabens, sulfates, it's BPA, it's so many different things. I think I'm just going to give you a full list of all the things. And so whenever you are choosing your sanitary products, that means your tampons, your pads, your discs, everything, you want to choose a company that is providing you with products that are devoid, meaning it does not have a lot of the things that can cause cancer. You can Google this. I promise you, if you Google things that can cause cancer, chemicals that can cause cancer, and the products that they're in, you realize that it's a lot of stuff. The perfume we use, deodorants, like I mentioned. And so you want to specifically choose a manufacturer or a company, a brand that does not include ingredients that has these bad chemicals. We call them, they're chemotactic. Okay. You don't want these chemicals in the things that you're using. Okay. So natural doesn't necessarily do it. Organic doesn't necessarily always do it. So really investigate into your brand and check to see if they use or include things that may cause cancer. Okay. The thing about our bodies as females is that our skin absorbs anything you put on it. So when you shower and you use your soap, body wash, hard soaps, any chemicals that are in them are being absorbed into your skin. Okay. There's a reason why when you use a moisturizer, it can actually moisturize your skin and allow your skin to grow healthy, because it goes into the hair follicles and into those small little pores, and it gets absorbed into your body, gets to your bloodstream. And as females, it will affect your hormonal balance 100%. And so what happens is that you have pelvic problems, you have PCOS, endometriosis, you have fibroids, you have heavy bleeding, you have polyps, you have all these issues, you have cysts of all types, because these chemicals are getting into your body and into your streams and causing an effect on your pelvic system. And these ovaries, which are so precious to us, that are really trying to balance out our hormones constantly. When we put all these chemicals into our system, we are causing your ovaries to overwork and get tired and get burnt out. And when that happens, you can cause cancer. All right. So let's not stress our bodies as much. Again, I have TikToks that list these products and the ingredients for you to avoid. And I'm going to put it on my list of an option to use for an upcoming TikTok. Okay. All right, so I hope you enjoyed it. This is going to be it for today. I will be back on next week. I'm actually going to put up a poll on my Instagram stories to see what time you'd prefer for us to have this discussion. But we'll be back next week. I hope you learned something. I want you to be advocates for yourselves. My goal is to educate you in a way that we can't do in the doctor's office. Yes, I would love to do it, but it's hard for me to spend an hour, kind of because the system is that way, right? But I want you to enjoy this space so that we can talk about these things. We can help you to live your best life. I want you to be able to learn techniques and ways to help your body function at its best, for your vaginal health to be up to par, for your uterus to function well, for you to feel good every single day. No fatigue, no stress, no feeling like you are so imbalanced and just not be lost. I want you to have a space that's going to work for you to help you be your best selves. Okay. Thank you for being here. I feel like I want to give you take one more question. You want me to take one more? Let's take one more. I'm going to take one more. Okay. And again, you can always sign up for my newsletter because you'll get updates with everything. I'm going to show you my website as I find a question. Okay. So it's up, it's, flip the other way, but if you can see this, callmedrp.com. It's going to be a resource, an expert resource where you can get anything you need. But I'm going to give you one more question. One more. I'm going to scroll. Let's see where it stops. Okay. Hangover cure. That's not the question, but B12. If you are going to drink, this is unofficial that I'm giving you this info. Okay. But if you're going to drink and you're going to get it in tonight or any other night, okay, one thing you can do is you want to take something that has a lot of B12, okay? So B vitamins are wonderful to help protect your liver. Your liver is what breaks down alcohol, okay? So if you're going to drink a lot, have something that with a lot of B vitamins, okay? So your shots, energy shots, often has a lot of B12 in there and lots of water. Okay. But that's not the OBGYN question. Okay. That was just on the side. All right. So, okay. One more. How do you stop? I'm thinking a yeast infection. Ooh, good question. All right. So yeast infections are caused by the vaginal space here and all the flora that lives there. So everything yeast is supposed to be there. You want yeast to be there. You don't want your vagina to be void of yeast because you will get even more infections. Yeast is there to protect your vagina. You want it. Okay. But you want your yeast to be in the amount that it's supposed to be in. Once you start growing extra yeast, that's when you get a yeast infection. All right. Now, moisture causes yeast infections. Okay. So it's like the environment that causes the yeast to incubate and to grow more and more and more. And so while the vaginal space should be moist, it should be a wet space. It should not have too much moisture. So when you exercise, if you exercise and you're in wet, sweaty clothing and you drive home and you go to the grocery store, you go to the restaurant to grab something to eat, and you get home and then you're cleaning, you're taking care of the kids, you are, playing a video game, reading a book, and then you go and take a shower 3 and 4 hours later, guess what? All of that extra sweat that's been sitting in the vaginal space, in the vaginal area, on your underwear, on your pants, or whatever, that is causing that yeast that is living normally in your vagina to overgrow. Same thing with having unprotected sexual activity. Semen, because it's moisture in this vaginal space here, will cause that yeast to overgrow. Same thing with swimming. If you are swimming and water is on the outside, but water can somehow creep up a little bit, you can get a yeast infection. Steaming can cause that to happen there because you're putting all this extra moisture and causing the yeast that normally lives there to overgrow, and you can increase the amount of infections that you're getting. So if you're getting recurrent yeast infections, recurrent meaning that you are having this over and over and over and over again, you're getting itching, you're feeling inflamed, the vaginal area feels swollen, it feels tender, you're having pain with sexual activity because of the yeast that is there. You want to do a full investigation to see what it is that you might be doing in your lifestyle that can be causing the yeast that lives in the vagina to overgrow. Okay. Once you find that problem and you eliminate it, I promise you will not have as much yeast infections anymore. Okay. And so a quick follow up. Yes, there are things that you can do, and I've done a TikTok on this as well as things that you can do at home to kind of help you. I'm going to say cure. Cure is really not the right word, but to control or prevent you from having yeast infections. So you can check that TikTok out. But there are things and regimens and that you can try at home. The best thing to do though is to eliminate the problem so that you don't keep having it. Okay. And that's going to be the final one. That's it for today. Okay. So it's Dr. P again. If you're new to me, if you've never been here, this is a wonderful space for you to be at. And going forward, we're going to have these sessions a lot more regularly. Check out the website. Leave your info so that we can notify you when different information gets posted. And again, once it launches, I'll be back here, but I'll be here next Sunday for sure. And we'll have a chat again and we'll talk about PCOS. We're going to put that at the top of the list. Okay. All right, so it's been a pleasure. Thank you so much. It's Dr. P. I love being here with you, and I love you all. Thank you so much, and I will see you in about a week. All right? Take care.